Good morning and welcome to the first day of our last week of budget hearings. I say that with a smile. No. Today we are going to be joined by the Department of Corrections and the Board of Probation and Parole. So we're so glad to have Secretary Henry with us and Chairman Fox here with us this morning. Before we begin, Chairman Struzzi, any introductory comments?
Yes, thank you, Chairman Harris. Good morning, everyone, and welcome. As the good chairman said, this is our last week of hearings, but we still have a lot of work to do, and I know that the work that you do is very important to our Commonwealth, so we will get into the questioning. But before we do that, I want to lay out the budget numbers so that people understand what we're talking about in context. The governor's request for the upcoming fiscal year 25-26 is roughly about $3.3 billion for both of your departments and agencies, about a $143 million increase or 4.5%. So with that said, I know we have a lot of questions to get to, so we welcome your testimony. Thank you.
Thank the gentleman. Before we begin, Secretary Henry, Chairman Fox, if you could introduce the folks that you have at the table with you, and then at the conclusion, we'll get up and we'll swear everybody in. Thank
you. As you know, I'm Dr. Laurel Harry, Secretary of Corrections. This is Deputy Secretary Christopher Ottman, Deputy of Administration. We have Dr. Robert Marsh. He is our Regional Deputy Secretary in the Central Region over our facilities in the Central Region. We have Kelly Evans. She is our Executive Deputy Secretary of Reentry, Community Corrections, and Field Services. We have Dr. Lucas Malischak. He is our Deputy Secretary for Reentry. Deb Carpenter is the Deputy Secretary for Parole Field Services. And then, of course, Chairman Fox, the Secretary, not the Secretary of the Board, Chairman of the Board. Thank you.
Thank you. If everybody could stand so we can swear you all in. Testifiers, do you solemnly swear that the testimony you're about to give is the truth, the whole truth, so help you God? Thank you. You may be seated. All right, we'll start with the gentleman from Philadelphia County. I can almost assume what he might ask about. Representative Waxman.
Good morning. Thank you, Chair. And thank you all for being here. It's good to see all of you this morning. The last time that you came before the Appropriations Committee, we talked about SCI, a specialized unit at SCI Chester, which is called Little Scandinavia. It is my understanding that there are some significant updates since the last time that we talked about this. Could you please share those?
Yes, absolutely. Thank you for specifically for showing an interest in Little Scandinavia. So we're really proud of the work that they've done there. It's modeled after the Swedish model of corrections. And we are awaiting the final research results, but the research up to this point looks very positive. I had an opportunity to travel with the Chester team as part of the research with Drexel to Sweden. Got to interact with them and talk to them, and that was extremely helpful. They all talked about having a less stressed environment working on this unit, a sense of purpose, because of course they're giving back and there's more staff to inmate contact and involvement. And also the incarcerated population has felt the same way. They've only had one inmate fight on the unit. In all fairness, we've seen that on some of our other specialized units as well. But it's looking very promising to the point where we're hoping to expand it to 3 other facilities, hopefully this year.
Wow, so that's very exciting news. Let me ask you, mentioned that in the period that the unit has been open, there has been really just one incident of a fight. How does that compare with just a standard unit at most SCIs?
Well, it's certainly less than like what we would classify as a custody level 4 housing unit, that it has custody levels 2s, 3s, and 4s. We generally see less violence on some of our specialized units, like our veteran services units, our custody level 2 units. But yes, because there are 2s and 3s mostly on this unit, it definitely is less than we see in other facilities on a general population unit. And just to comment, one of the things that we want to look at with research is putting it at a maximum security facility with custody level 4s. Chester was kind of designed to be more of a treatment facility to begin with. It's smaller. So it's always kind of had that, it was kind of tuned up to be successful. Of course, the staff have done an amazing job. I don't want to take away from any of the work that they've done, but we really want to translate it to other settings and get research partners to really measure some of those other data points that we're looking at in some larger, more higher level security institutions.
So you said that you're now looking to expand this model to at least 3 other facilities within the system. Can you describe just what the experience will be for starting with inmates on those on those units, and then I'd like to ask you some questions about the staff.
Sure. So for the incarcerated population, at least at Chester, they have single cells. Now, of course, as you know, with our proposed closures, which I'm sure we may be discussing today, that may depend on what that looks like. They do have more amenities. They have like a refrigerator in their cell. They eat congregate meals together. They have a kitchenette. So they have different things that aren't necessarily available on another type of a housing unit. And also, I believe that the incarcerated individuals on those units do feel safer because there is less violence. There's more of a camaraderie amongst the inmate population. So I think those are some of the things, key takeaways for the inmate population.
And so on a traditional SCI unit, staff are essentially prohibited from having any real type of relationship with any of the incarcerated individuals that are on their, necessarily on their wing or under their supervision. That is different at SCI, in Little Scandinavia and in this model. How is it different for staff?
Well, I won't say that it's prohibited, but it's different. Yeah. Like you said, the folks on the Little Scandinavia unit can exercise with the inmates. They can eat meals with the inmates. So it is kind of a different type of interaction than we would see on a regular housing unit with, let's say, 250 inmates. And on that point, it is a smaller unit. I think they can house up to 64 inmates. They average around 57 or so. But you asked about the staff, correct? Yeah. I think that was one of the biggest benefits, right? We're looking at staff wellness because we know corrections is a challenging environment. And I think one of the key benefits is that the staff, and I spoke to them, they feel much calmer walking onto that unit, less stress working on that unit. They definitely feel a sense of purpose working on that unit. So I think the staff wellness piece is huge for us because we want those positive interactions. I know EDS has talked often, some of the reentrants who get out will specifically talk about the impact that an officer had on their incarceration. So those are the types of interactions that we really encourage in our department.
Well, thank you. I see my time has expired, even though the timing rules were not explained prior to me getting up to the mic.
Ouch.
I'm teasing the chairman. Thank you so much for your time.
The gentleman will not be talking anymore this week. For those who do not remember the rules, when the light turns green, our members will commence with their questions. They have 5 minutes to ask questions. When the light is yellow, that means there are 30 seconds left. And when the light turns red, we would ask that folks would conclude so we can get as many questions in as possible.
Thank you.
Next time we redistrict, we can get rid of the one, never mind. Representative Mustela.
Thank you, Chairman Harris. And thank you for this opportunity to ask some questions. Dr. Harry, we had heard earlier last month that the department had announced a couple planned closures of SCI Rockview and the Kehana boot camp that was announced earlier last month. And just curious, what factors led to this decision for these closures, and what conversations did you have with some of the local officials that led to this?
Okay, first of all, we anticipated some of these questions. I just kind of want to give a disclaimer because, of course, the very legislation that you proposed, Act 133, we want to make sure we uphold the integrity of that process, and we are currently in the feedback process of the Act 133 process. I do want to correct you when you said planned closures. These are proposed closures. We have not made a final decision yet because we are in the 3-month feedback period. I will refer to Deputy Ottman as to some of the criteria that we looked at. Was that your question? What were some of the things that we looked at?
Some of the criteria, who really was behind this, who was the steering committee, how was it made up, who was it comprised of?
Yes.
And how were they appointed to this?
And I will just say one of the biggest factors is obviously our population reduction. When you said, how did it, I think one of your questions was, how did it come to be proposed? It's not been a secret that we've had vacant bed space in our department. And so for several years now, prior to even my taking the seat, the department has really looked at how we can maximize our bed space. And of course, COVID kind of put a stop to everything because we kind of were in that period where we had to manage in place. But Deputy, would you like to share a little bit about some of the steering committee's efforts?
Sure, I can give you some background. Closing a prison is something we have to evaluate prior to each budget cycle in anticipation of the appropriation we will receive. Based on our current and forecasted population, we have excess capacity in our correctional system with great demands for taxpayer funding. DOC management compiles all the relevant information on an annual basis to include all of our expenditures, infrastructure, non-recurring maintenance, capital projects, staffing levels, specialized housing, infirmary units, security issues, all that is compiled. And once that's compiled, this information, it's vital to ensure that all of our programs directly support and advance our core mission of public safety in the most efficient and effective manner. So just in conclusion, based upon our current facility footprint, inmate population, and our fiscal appropriation, our steering committee will make recommendations to the executive team on the closures that have the least impact on staff, inmates, programs, and continue our mission of rehabilitation and public safety.
Okay.
So that encompasses basically what we're doing.
So can I just interrupt for just 1 second, if you don't mind? Who is on that steering committee?
It would be myself and most of the other managers, management staff that are the directors in some of our bureaus, whether that's our Bureau of Administration, Planning and Research, Population Management, Facilities Management, Security, those people, the heads of those departments would be on that committee.
And who appointed that committee, or is that just how they're always made up when these proposed closures are discussed?
It was something that was put into place with prior closures. Obviously, the legislation doesn't dictate kind of pre-announcement what that looks like. So the department developed just guidelines of best practices, and the steering committee was one of those.
Okay. And then the other half of that, my original question was, do you take any input from the local officials, or do you talk to them? Do you bring them to the table, not so much to the steering committee as it's made up of who you want it to be made up of, but are they consulted with this at all?
Yes, that's part of the Act 133 process, and that's the part we're in right now. They are a stakeholder. They received a stakeholder letter, local officials, state, other Commonwealth agencies, and we reach out to them and invite that feedback. That's what this period is for, this 3-month period, to evaluate any feedback that comes in from local officials, and we will certainly look at that before we make a final decision.
Okay. And then talking about the boot camp that is on this proposed closure list, and I do apologize that I misspoke. How long has that been an ongoing boot camp? How long has that been there?
Oh, it's been, 1992.
92?
Yes.
What's the success rate on that? Is it something that you can point to that it has been successful, that maybe it shouldn't be on the chopping block?
Well, it's. I want to kind of outline what that looks like. So boot camp, because it was from 1992, we've had changes in JRI legislation, which collectively we worked with you on. And the reality is JRI 2 legislation is working. That's one of the reasons our population is down. The boot camp has kind of evolved, and unfortunately, the majority of the folks who meet criteria for boot camp, many meet criteria for state drug treatment, and that's the option that they are actually utilizing more than boot camp. And state drug treatment is for folks who have a substance abuse.
Okay. Mr. Chairman, can I just ask a very quick question? It will be a number.
30 seconds.
30 seconds, okay. How many times did the steering committee meet prior to this announcement?
I don't have an exact number, but we've at least met back in October. We updated.
Steering committee. The steering committee started meeting.
The steering committee, I'm sorry. That's who I meant, I'm sorry.
Yes, in January, they would have met and started the process.
It was multiple times, I want to say 3 or 4 times.
Yeah.
From January until the announcement?
Correct.
Gotcha. Okay, thank you, Mr. Chairman.
Thank the gentlelady. Representative Kincaid.
Thank you, Mr. Chairman. I have a number of questions, so I'm going to go try to go fast. When we talk about the cost and cost savings, we look at places like SEI Waymart and SEI Laurel Highlands are effectively, nursing homes with bars on the windows. And so I'm wondering, there have been a number of proposals over the years to modify our medical release program. Would a more efficient medical release program bring the cost down for DOC?
So we've had these discussions before. I think one of the biggest challenges is the individuals at places like Laurel Highlands and Waymart in skilled nursing care, many of them, mental health issues, medical issues, and violent crimes. Very hard to place in the community. So when we look at like a medical parole or expanding compassionate release or something like that, the biggest challenge is probably not that piece, not putting them up for parole, because we have processes to do that. The challenge is, where will we put these individuals? Mm-hmm. And then, of course, you shift the cost. So, right, the cost is with the Department of Corrections, obviously, and then if they get placed in the community, then that cost shifts to a different state agency, DHS and Medicaid.
Mm-hmm. Thank you. When we're talking about cost savings, I think that we can also talk about lawsuits that have been filed and the cost to Pennsylvania taxpayers on that front. And I want to specifically talk about the lawsuits that have been filed with specifically the contractor, the medical contractor at SEI Phoenix. They've now declared bankruptcy, and the lawsuits that are pending in Pennsylvania, depending on the outcome of that bankruptcy, could be fully put onto the taxpayers of Pennsylvania, because they could be shifted to DOC to cover those. And I'm wondering, really, when it comes to replacing that contractor, what the DOC's plan is to ensure that the next contractor does not fail to provide adequate medical care such that they are subject to so many lawsuits that they go bankrupt.
Just a couple key points before I turn it over to Deputy Ottman. You had said the care that's provided Phoenix. WellPath is our entire medical vendor for the entire Commonwealth. And just to be clear, inmate care has not been jeopardized based on their issues with bankruptcy. Go ahead.
Yeah, the WellPath filed for bankruptcy back in November. So any claims prior to that has to be adjudicated through the court system. Anything after November going forward, WellPath has renegotiated terms with all their providers, all their subcontractors, and they're receiving payment normally within 30 days, as long as the invoices are posted properly. Now, this contract ends here in the fall of 2025. There's already an RFP that's already been that's been posted.
I appreciate that. I don't have a lot of time. I don't need the process of the RFP. I want to know how it is that you're going to ensure that you are going to hire somebody that is going to provide adequate medical care.
Well, we can't discuss the RFP because it's currently in process, but what we will tell you is any issues that we've ever had with any medical vendor, whether it was WellPath or vendors prior, anytime we have an issue, we immediately, our bureau director reaches out to them. We've reached out to them at the executive level and tell them what the issue is, and we explain that, look, this is what's you're contractually obligated to do, and if they don't do it, we put them on notice, and that would be no different with any other vendor.
Yeah.
At any time, we can put them on CRP and then start to push forward terminating a contract if that's necessary. But payment language would be the standard language that we use for any Commonwealth contract. And we'll make sure that they pay their bills.
Because there are 62, at least 62 gentlemen at SEI Phoenix that have complex medical issues that have not been adequately treated and are having ongoing issues accessing medical care. I want to turn to the fact that there was a Legionnaires outbreak also at SEI Phoenix, and what it is that the department is doing to ensure that sanitary conditions are adequate such that, things like that don't happen anymore.
Right, and I know I don't have much time. Yes, they did have, and it was not an outbreak. There were 3 individuals who tested positive for Legionella. We brought on an expert a couple of years ago, and she was very, very helpful. She was out of University of Pittsburgh, and we do regular disinfecting. This is all part of our plans through maintenance, disinfecting of shower heads and cooling towers and air handling units, and we did all of that. There were no tests inside the facility that tested positive, but there was a positive test out of their cooling towers, and we worked with the vendor to, again, sanitize and do remediation efforts. So yes, all that information has been put out to our maintenance departments and our safety folks as well.
Thank you. Mr. Chairman, may I have 30 seconds? Please.
Yes, you may.
Thank you, Mr. Chairman. There have been a number of reports of false positive drug tests and of K2 since October, but false positive drug tests dating back all the way to April of last year. I had asked about how many people had been impacted by that. The only information that I was provided was through the Prison Society about 23 people who were applying for parole that had been impacted. And so I would just ask that I actually get the information about how many individuals have been impacted by the testing issues that have been going on and where the status is for that. So thank you. Thank you, Mr. Chairman.
Thank you, General.
We can provide that information, but just to be very clear, they were not false positives, but we'll provide that.
Thank the gentlelady, Representative Brown.
Thank you, Chairman. Madam Secretary, at the end of 2024, your December population report indicated that the DOC system was at 82.6% of capacity. Do you have an estimate of what that percentage will be once the 2 new prisons are closed?
If a decision is made that these 2 facilities would be closed, we're looking at potentially less than a 90% capacity in our male facilities and less than an 80% capacity in our female facilities.
And what is the range that you would like to maintain, or is there a range?
Well, I think at our highest capacity, we were at 51,000, and we had to send inmates out of state. So we were definitely over capacity. That was back in like 2010, 2011, when we're sending inmates to other states. That's not a range we want to be at. The range we're at now is fine, but of course we have capacity. We're still not at 100% capacity. So difficult to kind of answer that. With some of our infrastructure issues, it is good to have availabilities to kind of move inmates to another housing unit if there would be a heating issue or water issue. But we feel very comfortable with the capacities that we would be at, even with the closures, if the closures occur.
So I'd like to discuss what happens after the closure of a facility, because your website provides descriptions of 6 closed facilities, but I noticed that 2 of them, SCI Pittsburgh and SCI Retreat, are still in your budget in the list of costs by institution. It appears they are still costing our taxpayers a combined $2.25 million per year. So what's the current status of Pittsburgh and Retreat, and how long do you expect that they'll be in your budget?
For those facilities, we're obligated to maintain them for a certain amount of years per regulations with DGS. Now, my understanding is there's been a lot of filming done at Pittsburgh, so there's been some use for it. A variety of different movies or series have been filmed there. So as long as there's some use for that, I think that's why Pittsburgh's been extended. Now, I know that there's demolition that they're working on. They've done the facility analysis. They're talking about demolition almost $40 to $50 million to raise Pittsburgh. With Retreat, we're still maintaining that. We're heating it, still providing security for that, and and maintenance costs. So that's why you see some of those residual costs. And those are always calculated when we're looking, if we close a prison, there's an obligation we have to maintain that to see if there's any interest in that real estate or for other usage, whether that be through the Commonwealth or the local counties. We had some counties come and look at SCI Retreat, possibly to run it as a correctional jail, things of that nature.
So are there any barriers to those facilities being sold?
None for us. I mean, it's a legislation, so you'd have to vote on that. But that would be handled by the DGS. Anytime there's a property that's bought or sold, it runs through legislation to get it passed.
Okay, got it. Do you expect any challenges in getting rid of the Kayana and Rockview properties?
Well, some of that we'd have to maintain. The SCI Rockview sits right next to SCI Benner. There is a corridor of a reservoir that was just recently updated and water treatment, and that reservoir provides water to both facilities. So there is a good section of the property of Rockview that we would definitely have to maintain because it provides utilities to the facility. For Quayhana, not as much, but there are some other entities that are on our water and the sewage treatment plant. We have well water there, but there's also a sewage treatment plant. There's a PennDOT facility, there's a flooring company, and the Pennsylvania Game Commission also uses that utility. So there are a few other agencies utilizing that utility as well as a private contractor.
So I'm actually glad you bring that up because there's more than 5,700 acres apparently outside of its perimeter. Are there any plans of what you would do with that land moving forward?
Are you talking Quayhana?
Yes.
Our footprint's not that big. That some of that.
I'm sorry, no, SCI Benner Township.
Well,
Rockview, you're referring to.
Rockview.
Rockview, that's the part I'm talking about. We'd have to maintain a certain acreage because of the utilities and the reservoir that runs in between the mountain gap across the street from Rockview, basically. And that also feeds Benner for water and some of our forestry programs located over there. We do have a security processing center for all of our mail. We have our canine unit. Benner can support all those, but there's utilities on that land that we'd have to maintain that reservoir. But there are portions of that land, I'm sure, that if there is interest for, that could be looked at to be portion those pieces out for the local area.
Got it. Okay, thank you.
Thank the gentlelady, and thank the gentlelady for sticking within the 5 minutes. Let's see if Representative Friel could do the same.
Thank you, Mr. Chairman, and thank you for the clarity with which you've clearly and concisely communicated the time limits of questions on multiple occasions. And as such, I will endeavor to remain within those constraints so clearly communicated. Therefore, I will begin my questions. Thank you, sir. I want to talk about the reclassification. When we're talking about the closure of Rockville and looking at the DOC, there's been some reclassification of occupancy capacity, and just want to understand how that falls into, because as I read it, for example, Rockville's capacity was 2,159 beds back in 2024, and with the reclassification, they're now 2,543. However, you didn't really add any new, it's just a reclassification. And some of those beds, when you say the total, are for specific types of treatment or types of specialty populations that I assume would not be available to the general population. So the capacity isn't a fixed number, it has multiple cohorts in there. Can you explain to us what those populations are, how they impacted, and why the change in capacity?
Yes, I certainly appreciate your knowledge of that process. So if I say we have roughly 6,000 vacant beds, that doesn't mean that they're all usable to every incarcerated individual. So the first part of your question is yes, we have restrictive housing beds. I think there's roughly 1,600 vacant restrictive housing beds. Well, that's not for the general population, as you said. We have state drug treatment beds, we have therapeutic community, mental health type beds, lots of little Scandinavia units. So we have all these different types of specialized beds, but there will be individuals, if we close, that could plug into specialized units, right? Whether it's therapeutic community, a residential treatment unit, that kind of thing. Regard to your question about the change of beds or reclassification, what happened, I believe this is what you're referring to. So what happened is when folks were looking at publishing our vacant bed space, we recognized that, right, during COVID, we actually took beds offline to make sure we had a manageable capacity because of COVID. When that was uncovered, we obviously were like, wait a minute, we're in a post-COVID world now, we can release those beds, and that's probably, I think that's what you're referring to when you said you saw like a reclassification of beds. So that's kind of what happened there. We made sure those are usable beds now because we don't have to social distance and those kinds of things, restrictions around COVID.
So it was a restriction during COVID that said, I'm removing capacity, now I've added that capacity back, and it's equal to the pre-COVID numbers. Is that what you're saying approximately?
Yes, should be, yes.
Okay, thank you very much for that explanation. One other question. I want to talk about the different cohorts of populations. How much of the prison population in Pennsylvania is really either mental health or, requires a mental health treatment? We had the Attorney General, we had Supreme Court in here last week, and a lot of them talked about the diversionary and treatment courts and getting folks out of the system. You're dealing with the folks once they come in. Are we seeing an uptick in that? And do we have a capacity issue with mental health or drug treatment in Pennsylvania's population of prisoners?
Well, I'll start off by saying our mental health practitioners, our substance use practitioners do an amazing job with our specialized units. Our population as of December was 39,396 inmates. 14,161 have a mental health need. That's a huge chunk of our population, around 36, 37%. 2,830 are classified as seriously mentally ill. So many of those individuals are on some of our specialized residential treatment units, but of course, some of the other 14,000 are also on those units as well, and they're receiving care. We are a mental health provider. And I will say, I think we have the capacity. We have how many institutions? Is it 15 that? 14 institutions that are designated to specifically address mental health needs. We increased the staffing at those facilities when we were going through our mental health initiatives about 7, 8 years ago. So we're in a good position with our mental health providers, and they really do an amazing job, considering that you're right, many individuals who come
And I see
to
my
us
time
need
is
that.
about to expire, so I want to be respectful of that and the chairman. Thank you, sir.
Thank you.
Thank the gentleman. Representative Barton.
Thank you, Chairman, and welcome, team, Department of Corrections. Secretary Harry, having a full complement of correction officers is going to increase safety, right, and certainly lower taxpayer money if we decrease overtime as well, right? So with that in mind, we know that you've been dealing with, like many other businesses, stubbornly high vacancy among correction officers specifically, and it's been for some time now. One of several changes the department has made to help deal with this is by lowering the minimum age of correction officer trainee to 18. And this aligns with other ages or other positions within the corrections, but it also similar to age for corrections in other states as well. So I guess, can you share with us how this change is working for you?
Yeah, and I'll be the first to admit, I did not think we would see the impact that we have seen. We started a year ago in January of 2023, and we hired 211 individuals under the age of 21. And we did enhance our mentoring services, and we really wanted to make sure that we provided these individuals with the resources that they need, in addition to all our trainees for that matter. But we have seen great dividends. The other important factor is we've seen that this group of individuals actually, we see better retention rates with them. For the first 9 months, only 4.7 of those individuals end up washing out or leaving our system. 25.3% of our over 21 individuals end up leaving. So it's actually what we're doing is working. It's been very positive for us.
It sounds like a success, increasing numbers and better retention rate. Those are good numbers.
Correct.
So we definitely want to continue this, right?
Yes.
Let me, in the same line of questioning, Dr. Harry, was the ability to hire people from out of state also for DOC jobs. Can you share with us, have we seen similar success, or can you share with that?
Actually, we haven't, but I don't want to say, maybe it's just that because it was, again, recently started with the same numbers. It was under 10, I believe. Yeah, it was under 10. It was 7 individuals.
10 people?
It was 7 total.
Wow.
It's been under 10. Now, we just had 12 people apply for parole agent out of state. Not everybody who applies obviously gets hired. But I don't want to shut out that that's not going to be effective because, again, it's 7 more people than we had prior to that going through. I actually would have thought it would have been reversed, that we would have seen more with that out-of-state waiver. It's just maybe not caught on just yet, but we have areas obviously close to Philadelphia, even in this area, Maryland, and then, of course, southwestern Pennsylvania, other states close to Ohio. So we're still hopeful, and it's still an avenue for us, but we have not seen the numbers that we've seen with our underserved.
So in business, we see regularly people coming in from out of state to work. Can you identify any reasons why people wouldn't come?
Yeah, I don't know if it's because they're unaware, but I know our recruitment and retention team has targeted areas outside of Pennsylvania as well. They know that that's an option. We're going to continue to look at the data and, of course, ask people when they come in, how did you hear about us? You know, we're putting we have some not bulletin boards, billboards, thank you. Billboards on the highways, you know, to catch folks to express an interest. So we're still going to track it, though, and we want to probably get the information from the folks applying and see if there's different ways that we can market better.
Thank you very much, Secretary Harry. I yield my time, Chairman.
You're welcome.
Thank the good gentleman. Representative Cod.
Thank you, Chairman Harris, and thank you, Secretary Harry, and thank you for your staff. So I'm a nurse practitioner, and I want to ask about really health, focusing on health. And so as a nurse practitioner, I have patients that come from Gaudensia who are transitioning from being incarcerated and seeing a lot of high A1Cs, the diabetes being really uncontrolled. And I've been hearing that there's a lot of issues regarding the quality and the nutritional benefit of the food that they're getting while they're incarcerated. And also, I believe there's a recent report about making sure that we're calling attention to the lack of nutritious foods available to inmates. So can you talk about sort of what currently exists now for people who are incarcerated in terms of nutritional quality of the food, and what more can we do to ensure that they're getting high quality nutritious foods since they can't go anywhere else to decide where they're going to get the food? And also is Penn Ag, the fact agriculture is one of our leading industries, growing food here in our Commonwealth, is that an option too, to getting more fresh foods grown in Pennsylvania?
So a couple questions in there. Just to address the last point, yes, we have vendors that we use in Pennsylvania for produce, dairy, beef, poultry, pork. So we are using Pennsylvania vendors for our roughly 31%. We spent $3 million last year on a menu refresh for our incarcerated population, and that included using the U.S. Dietary Guidelines, 2020 to 2025 guidelines, and we looked at things like increasing proteins, decreasing carbohydrates, reducing sodium, reducing fat. So this was a concerted effort that had been in the works for a bit of time. We have 2 dietitians. We have a director of our bureau that spent a lot of time, and they have experience to really evaluate making sure that our menus are healthy for our population. Another thing to note, and I'm not sure if that's what you were referring to or if alluding to, we also allow the inmates to purchase commissary items. So $56 million was spent in commissary, but diabetics, we have sugar-free candy as an option, but it's not a popular option. And we've had individuals where folks are saying, hey, don't be buying this kind of food, it's not healthy for you, but it's just like us. When we go to the grocery store, we have options, and we can choose the fatty items or the sugary items, or we can try to choose healthy foods. So we do work with those individuals because sometimes they don't make the right choices with commissary. That's why we want to make sure for our menu and our food that we're putting forward that it's healthy for our population. Anything to add?
No, she touched on most of it, but again, the master menu is nutritionally balanced and accommodates a 2,300 calorie diet. It addresses heart healthy, high fiber, liberal diabetic, lower sodium, low fat, and cardiac.
Thank you. Thank you. And I can tell you, one point I have a private school. I have a number of private schools in my district, and I can tell you that as good as the food was, when they actually they went to this kind of this DoorDash model where they increased the quality of the food. And just talking about that point, the quality of the food, these kids in private schools already getting good food, getting really good food. They said that their attention improved. We know that it's on health, the impact on health. Having quality food that you would want to eat, actually makes people healthier, and I think that may actually reduce some of the costs too, including the cost you spend on medical care. So just something just to keep in mind. So thank you for your investment, the $3 million investment, and I encourage you, because that investment can really go a lot of way in prevention. The last question I wanted to ask is about the co-pays for inmates. And I understand during the pandemic, that was actually waived for a time, which I think is great. I can tell you as a healthcare provider, usually the more obstacles you put for people to access care, especially with emergent needs, that could end up being something more serious later on if not treated initially. Those barriers are actually bad for healthcare. And so I wanted to ask, in terms of the $5 copays for patients to see a provider for non-chronic issues, and also the $5 copay for medications for patients. I believe the average wage is like 23 cents an hour while in prison, something like that. Can you talk about the need to keep such a policy, and would you be willing to move away from that policy to make sure that more people get access to health care?
Right. Well, I certainly understand your concerns around it. As you mentioned, we saw disastrous, and I'm talking disastrous effects when we removed the copay. We saw an increase from anywhere from 25 to 42% of individuals putting in sick call slips. At one facility, 67% of the inmates put in sick call slips weekly. Our providers could not keep up. They were having backlogs with chronic care clinics, which do not require copays. These are individuals that have identified medical needs. And it was just, again, it was disastrous for us. We had providers who left because they said, we can't do this. I personally I can't support it because of that. For the very reason some inmates just want to get out of their cell for the day. They just want to go see their favorite provider. It's not a matter of they aren't coming, because we have a list of things that they don't provide a copay for: psychiatric meds, intakes, hospitalizations, chronic care. There's a huge list of things that they do not require a copay for. But personally, because we've seen that movie before and we know how it ends, I can't get there.
Yeah, thank you, Mr. Chairman. If I could just make one last comment, might be worthwhile to look at other options besides financial incentives to make sure that it's not being abused. Thank you.
Thank you, gentleman. Representative Eckert.
Thank you, Mr. Chairman, and thank you, Madam Secretary, for being here. I want to stay on the health topic, but talk about reentry program that I know the department is exploring, and specifically the DHS budget includes a $4.8 million reentry program, a reentry initiative. We all agree that these reentry programs are good. Under the Keystone of Health's Section 115 waiver, providing Medicaid coverage for those individuals 90 days before incarceration. Since this waiver is a supplement, I think currently, and not replacing existing funding, would the DOC budget remain unchanged if DHS is covering these MAT 90 days pre-reentry?
Well, first of all, we're really excited about this opportunity because we think it will actually help with recidivism, give folks those linkage from incarceration into the community. I'll kick it to either Deputy Ottman or Dr. Milischek to talk a little bit more about how it will positively impact us even financially.
Yeah, thank you for the question. As Secretary Harry was saying, super excited about the 11 and 15 waiver. The four primary interests and goals of us being involved in the 11 and 15 waiver are that we hope to polish up the reentry process by improving the warm handoff to community providers. We hope that we are also going to reduce the risk of overdose for these people who are coming from our system and going back out into the community, as we know the risk of overdose is the highest in the initial months coming out of prison. We also hope that the 11 and 15 waiver is going to contribute to reducing rates of recidivism, as it is going to focus on some of the most vulnerable population who are incarcerated, including...
Yeah, and if I may, and I'm with you.
The financial piece?
Yeah, I agree. You know, I support what we're trying to accomplish, but is there a cost savings too? You know,
Basically, any savings have to get reinvested back into treatment. So that's essentially the hidden cost savings, because more treatment obviously will help with better reentry initiatives.
There's also the opportunity to reduce recidivism, which we can put dollars on.
Correct.
As the Secretary said, it's a reinvestment. We can expand the MAT, the medicated assisted treatment. That's one of the biggest advantages we have. 90 days, we can start to treat them with Medicaid dollars, have a federal match, and then we can expand to other, as we save money, we can expand other treatments for the population with a substance use disorder.
Is there ever an opportunity to eventually shift this directly to, you know, this reentry, this MATs through DHS? Is there ever going to be a complete cost savings that you don't need to duplicate those services, or is there an opportunity there?
That might be a better question for DHS.
Well,
and we have DHS later in the week, and that, yeah.
We're providing the same treatment in our facilities to our inmate population. This is an opportunity to get Medicaid dollars to cover those within 90 days. So anyone that's going to be always within that 90 days to release, that's where the savings could be for us. But the larger savings really lies with the Department of Human Services.
Certainly, and staying in this vein, and again, you know, obviously corrections is one of our largest chunks of the budget. So I think looking at ways to reduce that budget is important. So kind of staying in this whole theme of DHS and corrections, something that I know I've worked on with Representative Krajewski is looking at terminally ill individuals. Obviously, it's a huge cost driver for you folks. What's the average cost of a terminally ill or very chronically sick inmate?
Over $700 a day for the skilled care units and our personal care units. And as a reference point, our average cost per minute per day is $185. So large, intense staffing with nursing, nurse assistants, physicians, and we have inmate porters that also help too as well. But this isn't talking, and also increased medications, hospitalizations, length of stay, outpatient treatments. Everything with the older population, as we know, increases our medical care. So any way that we could find an avenue where, but again, we've had problems with placement in the community, the appropriate number of skilled nursing care beds. But any way we can look to alleviate that would definitely help the DOC's budget.
And how many roughly incarcerated individuals are in that demographic? Severely terminally ill.
Well, we have 200 inmates in skilled care, 220 in personal care, and then we have a 12-bed neurocognitive unit for like dementia patients. But at any given point, we have a large number of people in our infirmaries that if those people were to leave for any reason, that can take those beds.
And what's the security level in those types of facilities? I mean, what's the...
All levels.
Okay.
2s, 3s, and 4s.
Okay. All right. Thank you, Mr. Chairman. I appreciate the opportunity.
Thank the gentleman. Representative Webster.
Thank you, Chairman. And Secretary, thanks for being here with a large team, because my little bit of time in the private sector tells us this is an expensive meeting when you count the hourly wages for all of us. An important meeting. Rep. Martin talked about vacancies in the correction officer staff, and Rep. Kincaid mentioned SCI Phoenix and a couple things there. That's my experience on my visits to SCI Phoenix. Can you sort of talk more generally, right? You've lowered the age to 18. There's some out-of-state hires, but there's still almost 500 vacancies for corrections officers. So how do we incentivize a career program that used to be better than retail, right? It used to be something that people could start and then have a 20 or 30-year career. How do we get to where the operational staff ratios are correct, the overtime comes down, safety's increased, the real big picture?
Right, there's lots of factors involved with that. I will say we could not be prouder of our recruitment and retention team that has done amazing work. I don't know if you saw our press release, but they've worked very closely with HR in reducing the time to fill, with our field, and scheduling interviews and making that process shorter, because one thing we did find was, right, out in the community, if you're interviewing for a job, you find out relatively quickly, right, if you're going to get the job. There were some layers that needed to be condensed, work simultaneously. So we fixed that so that we could reduce the time to fill for our population, or our staff population. We went from our highest vacancy rate of 10.5% in October of 2022, so just 2.5 years ago, to, which was roughly 930 vacancies, where we are now roughly a 4.8% vacancy rate, or anywhere about 420 some vacancies. So we've cut that number in half. We did over 750 recruitment events. So I think what we're doing is working, right? Obviously, the contractual raises that the officers got will help as well. The starting salary for a COT is almost $47,000, and then after a year, once they get off of their trainee on-the-job training period, they go up to $50,000. So all of these factors, I think, will help us. We continue to track it and monitor it, but I think we're on the right path.
In your budget requests, a large, there's a percentage of
Personnel.
costs that are going to be pension and benefits. Is some percentage of that sort of a legacy requirement? I know that in our school system retirements, the government of Pennsylvania didn't do the employer incentives way back around 2008. Is that similar? Do you have a similar backlog of expense in the pension and benefit arena?
I'm not aware of any legacy costs. The cost to carry is mostly for the increase in wages and salaries. That's roughly $56 million just for the correctional staff. And then you also do have some legacy in turnover rate between the age 50 and age 55, or age 60 to 65 retirement. Those factors, those numbers are changing. The employees under age 50 are more expensive for the employer versus age 55, better benefits or pension at the time. So some of that, as the turnover through time goes on, you are losing people under that older benefit program that is more costly to the employer, and then you're getting newer employees that are technically less costly. So that turnover rate is always changing. That's the only one I'm familiar with.
All right, last question, quick. I know we're trying to stay on time. I tend to be the nurse's advocate in a number of these scenarios. I like to point out that as a statewide organization, obviously your community, Department of Corrections, but the Department of Education, Department of Health, we all need nurses and staff. And where are you currently from, a lot of agency nurses to rebuilding your internal staff?
Yeah, again, we've made improvements, but it's a higher vacancy rate than our corrections officers. Right. We're averaging around 95 to 100 vacancies. I think this time last year we were over 120-ish. So again, it's coming down, but that's a group. We did a huge campaign, was it 2022 or 2023, to really try to target nurses, and it yielded, I think, no one. We're trying to think outside the box. We can't compete with $3,000 sign-on bonuses, $5,000 free schooling, those kinds of things, but we are making improvements.
And we did add, we have the annual retention bonus for the registered nurses, the RN, SEIU, they have agreed to that. So every year, at the end of the year, the RNs get a $1,000 bonus. And then with OPEIU, the registered nurse supervisors, they're getting a $1,500 bonus. Now, we'd love to see it with the LPNs, but that's another bargaining unit. So I think those retention bonuses definitely help. And we definitely would take a look at sign-on bonuses if we could, but this time we don't have them.
Thank you, Mr. Chairman. I did misspeak about being the advocate. There are a lot of advocates here for nurses. Thank you.
Thank the gentleman. Representative Flood.
Thank you, Chairman. Thank you to the panel for being here today. Last year, we discussed recently enacted legislation that would permit state parole agents and police officers employed by the Department of Corrections to wear body cameras. And as we know, body cameras are used to record interactions and gathering information that not only protects the parole agents and the officers, but also the inmates. So it was projected it was going to cost about $1.5 million in the state field supervision line item for the purchase of the body-worn cameras. And it was possible that the department could see an increase in future costs due to repair and maintenance and replacement of the body cameras, as well as data storage. Can you update us on the any costs that the department has incurred to implement body cameras, and if the $1.5 million was accurate.
Deputy Carpenter?
Hi, good morning.
Good morning.
So the status of the body cameras is in early 2024, we started the request for proposal process. If any of you are familiar with that process, it's a very lengthy process. So we established a committee that worked on the statement of work. We also worked on the draft policy. We met with other states who implemented a successful body camera program, and then the committee assigned subject matter experts and then finalized the requirements for the request for proposal process. We are now in those final phases. That request for proposal was put out in October of 2024, and we are currently reviewing those proposals. And hopefully our targeted implementation date is for the fourth quarter of 2025. Unfortunately, because this is the RFP, I don't have access right now to the cost submission, so I can't say what the cost is going to be.
Has the department developed any policies or procedures for the program?
So we did develop a draft policy for the program for the field parole agents. However, until we know who the awarded vendor is and the equipment that we're going to be using and how we're going to be uploading the data and storing the information, it's hard to say exactly when we'll finalize that policy, but it will be finalized before we move into the implementation phase.
Okay. Right, and because it hasn't been finalized, the cost is still obviously up in the air for some of that. But yes, it is going, those are going to be costs, as you accurately stated.
Okay, great, thank you. And then just kind of shifting gears back to a follow-up question that I have on the new model with the SCI Chester facility called the Little Scandinavia. We understand this model has produced lower rates of violence, better morale, mental health outcomes for both inmates and correction officers. If this model were expanded, do you think it could reduce costs to the Department of Corrections? That is, over the long term, is there data to suggest that it would cost less to incarcerate people in this way?
Well, it depends really on how we fully implement that. For example, in Sweden, every single inmate has a single cell. We don't have that capability in the Department of Corrections. Otherwise, we'd be building prisons, and of course, that's not saving money. So our model may look a little bit different than the Swedish model, but the general components of the congregate meals and staff to inmate interaction, ultimately, they're looking at recidivism, right? So if we can obviously put the price tag on these individuals not returning to our system, then yes, that is certainly a cost savings. But exact implementation would be more costly, and ironically, at the time we visited, they are actually looking at an increase in their population because their administration has seen a need because of violence in their communities to, so they may end up having to double cell, and we had some of those conversations. So I personally believe that model can actually work with variations to what they are doing.
Okay, thank you, and that's all I have. I'll give my time back.
You're working on your second gold star now. Representative Abney.
Thank you, Chairman Harris, and thank you, Madam Secretary and your team for being here. I wanted to first and foremost start off by extending my gratitude to you all. Last session, Rep. Krajewski and myself, we introduced legislation that was designed to help expand access to the voting ballot for folks that are incarcerated across Pennsylvania. And while most of the folks who are eligible to vote who are incarcerated are in our county jails and not our state facilities, both you and your team sat down with us, had a real honest conversation, and gave us really good feedback to ensure that that legislation was ready for prime time. So I want to first thank you for that. But my question is a little bit separate from that, and I think I might have asked this last year or the year before. It's sort of a workforce question, and it's around the rate in which those who are incarcerated and working are actually getting paid. I know there's a scale. It kind of varies a little bit. I think it was mentioned earlier, 23 cents, somewhere around there. Could you give us an update on what that looks like in terms of the pay?
Yeah, I think now would be a good time for me to put a plug in for PI legislation. That's something that we've tried to get across the finish line, and inmates would get a prevailing wage, and that's a whole other thing. But I do want to say that that's something we're very supportive of when we look at wages and getting folks skills for the community. Yes, the pay scale goes from a minimum of 23 cents an hour up to 61 cents an hour. Certainly things like our correctional industries, community works programs, many of them get the higher pay rate. We did give everyone a 20% raise back at the beginning of, it was tail end of 2022, beginning of 2023. That cost us a total of, I believe it was around $4 million. So that's kind of where we're at now with our pay scale for the incarcerated folks.
And help us understand, where does that fall in terms of, if we compare Pennsylvania to other states, are we paying in a similar range, or are we less, more?
We could probably get you some other data. Some states don't pay their incarcerated population, some do. I think when we sent folks out to Michigan and Virginia, they came back with different feedback, but we can see if Correctional Leaders Association, the group I'm in with other directors and commissioners, we can see if they actually did a survey, if we have any of that data.
Yeah, that would be very helpful. And I guess if there was a push to try to increase the pay for folks, would that be something that you all come to us and say, if you want us to increase the pay, you got to give us more money in the budget type of thing?
Correct, but I'd also say, hey, how about working with us on PI legislation? Because we really do feel that that's a great opportunity to give inmates real wages. It doesn't take away jobs from the community, and we actually have a director of our correctional industries who implemented PI in the state that she came from. So she knows the process, and we really think that that would be something very positive for our agency.
Well, I would be happy to work with whoever in the legislature is interested in introducing that or reintroducing that, as well as working with you and your staff. So thank you for your work. Thank you, Madam Secretary. Thank you, Mr. Chairman. Appreciate it. It's like.
Thank the gentleman. I like that time. All right. Representative Krupa.
Thank you, Mr. Chair, and thank you to all the testifiers who are here today. The governor's budget has program measures for the DOC that include the institutional violence rate on staff and on other persons combined per 100,000. This rate was at 58.7 in 2019-20, dropped significantly to 35 in 2020-21, increased to 43.9 for 2021-22, climbed again to 51 in 2022-23, and hit 60.3 for the 2023-24 actual measure. These numbers are going in the wrong direction and have been now for several years. Can you please provide the committee with the rate thus far this year, and are you seeing any decrease in the rate in the current year as projected in the budget program measures?
You're correct. We did see an increase in violence this past year, a 21% increase in violence. Obviously something very concerning because we want our facilities to be safe for both the staff and the incarcerated population. What I will say is we saw a significant chunk of that increase during the summer months from June to September. That is not unusual for us. We generally do see increases in violence during the summer months. Inmates are going out to yard, et cetera. It was also contained to roughly 7 of our facilities. We actually saw 5 facilities where they had a reduction in violence. So again, something that we're tracking. In response to that, we put together a violence reduction task force, and that was back in the fall, and we want to look at it in its totality, not just inmate-on-inmate violence, not just inmate-on-staff violence, but also staff-on-staff workplace violence, as well as staff on inmate improper uses of force. So we want to cover all those areas to see, are there places where there's more of a culture of that type of behavior. We also looked at the fact that it was one of our hottest summers on record this past year. There have been some studies to show that heat can impact the levels of violence. But the other thing we're doing that we hope will have positive results is we just started a statewide pilot for front-loading violence prevention treatment. So for individuals who have that need, we are trying to get them treatment on the front end rather than closer to their minimum date to see if that impacts our violence rates. And then lastly, we also looked at our misconduct sanctioning So we did a new sanctioning grid for that, but we also looked at which custody levels, which we've had an idea of how it would turn out. Custody level 4s generally have the highest levels of misconducts. So again, it gives us more data points in what we look at when we're trying to tackle this very issue. But you're right, we don't want it to go in that direction, and we want to make strides to decrease our violence. Oh, one more thing, we had an innovation day, and one of the key topics that we had line staff, managers, supervisors, and one of the topics for Innovation Day was reducing violence. So we're trying an all-hands-on-deck approach to that.
So in my prior life, solo practitioner, but the real passion of my work was civil rights and constitutional law. So I did a lot of conditions of confinement. Interestingly, or not surprisingly actually, the overpopulation and overcrowding issues was historically for my county prison, which you were actually at the ribbon cutting in Fayette County where we unveiled the new prison, which was much needed. But so through that litigation, I learned that there's a direct correlation between violence and overcrowding issues. Closing 2 facilities is naturally going to increase the inmate populations of the remaining facilities. Do you have any concerns that by placing more inmates in fewer facilities, this will increase levels of violence and jeopardize the safety of the staff and the inmates?
Very glad that you asked that question, because that's something that we track data on. We actually pulled data for our 5 prior closures. We looked at the 6 months prior to the closure and the 6 months after the closure. We actually found reductions in those 5 prior closures in violence. Reductions, an average of 1 less inmate on inmate assault and an average of 3 less inmate on staff assaults. We also had, back when our population was much higher than it is currently, the time period for the study was 2012, 2013, and 2014. And the University of Maryland conducted a study on not overcrowding, because some of the research, overcrowding is different than crowding fluctuations. Crowding fluctuations, there was no impact in that study based on our data for crowding fluctuations and violence. They did see a correlation with general misconducts, but not violent misconducts. So to answer your question, I think I said before, or maybe just because I have all these numbers running through my head, even if we would close Rockview and Quahana, we will still be at below 90% capacity for our male facilities and below 80% capacity for our female facilities. So at this point, we feel that our population will still be manageable.
Okay. Thank you for your testimony. I see I'm out of time. Thank you, Mr. Chair.
Thank the gentlelady. Representative Young.
Good morning. Happy Women History Month. And questions for you all. It appears that the decision to calculate the occupation capacity at these facilities is one of the reasons why the decision to close some of these facilities were necessary. Can you tell me, do you have any concerns about if these facilities were to close, where will the rest of these people who are incarcerated go? Do you still have the capacity occupancy concerns?
Yes, as I just mentioned, we will be able to function still at below our capacity. What I will tell you, for example, Quahana, if the facility would be proposed and the final decision would be made for closure, those populations, they're all custody level 2 inmates. We have state drug treatment programs in 3 other facilities, to include one of our female facilities, and the boot camp we would obviously have to relocate to another male institution, and then the females would again go to a female institution. Those numbers are so small, 365 inmates roughly at Quahana, so they would be able to move into the general population. Same thing with Rockview. Rockview does have some specialized programming, which will be part of the steering committee's review of where those people can plug back in. But again, our bed space is such that we do have the bed space to absorb those populations.
Okay, and my apologies if you answer this question, but since you mentioned Rockview State Prison, it has 5,700 acres of land. What could possibly happen with the land? How could it be used in
Right, as Deputy Altman said, there are parts of the land that are still being utilized by SCI Benner. So once we parse out all of that. Certainly that's something for a discussion for the Department of General Services, the communities. Even when I was at Camp Hill, people showed interest in the land. I know they've shown interest in the land at Rockview for quite some time now. So there are folks that could potentially be interested, but again, that doesn't lie so much with us as it would with Department of General Services.
All right, and last question, because I don't see the yellow light. Given the optics in the room, I just want to touch on the diversity of the people who are incarcerated, right? And the leadership who is making the decision to place the people who are incarcerated. How do you come up with those decisions? And is diversity a factor? Do you include people who may look different from the people right here in this room right now at the table?
You're just talking about staff diversity?
Leadership, the leadership in a department.
Yes, absolutely. Diversity is very important to us. I know the Shapiro administration values diversity as well, and our position on diversity hasn't changed. I've had multiple conversations with our leadership. We have monthly leadership meetings, and we've talked about the importance of diversity in all aspects, whether it's gender, not just gender and ethnicity, but also work experiences, backgrounds, experience within our system as well, folks who have worked in community corrections, coming inside going outside, all of that, because it is important to us. Our recruitment and retention team also is really focused on trying to go into areas that have more minority staff. And we have made improvements in a 10-year period. We have gone in the right direction, although there is African-American males we do struggle with in our department, getting African-American males. That's one group of a diverse group that we sometimes have trouble recruiting to come in, but we're doing everything we can to try to increase that diversity.
See, I would love to be able to work with your department to ensure that we are operating with fidelity, especially as we're having these leadership conversations, because the last few times I was here, and Appropriations and meeting with you all, I believe I asked a similar question. I just want to make sure that you understand it is on the top of mind. There's a lot of qualified applicants, people of color, and it's specifically to the skill set. So there's a lot of skills at every level, and it will be so wonderful next year when we're doing Appropriations to see more diversity at your leadership table. So thank you.
Thanks, Gentlelady Representative Nelson.
Thank you, Mr. Chair. Welcome. As we're having discussion today about potential closures, there's been some officer safety questions and in history on corrections officer safety. I'd like to start off in that safety area, specifically asking about the conductive distraction and escalation device, the CD3, those gloves that are able to be used to help proactively control. We're using them in our county prisons. What are your thoughts? To my knowledge, we're not using them within our state corrections facilities currently.
Actually, that was brought up, I want to say, was it about a year ago, and we had a demonstration to our executive staff. Our security division reviewed it. They always do a real thorough review of any type of new equipment, and they just found at the time there were some concerns with that, one of which was, I think they talked about if an individual had a lot of hair on their arms, that it was difficult, and even through clothing if you grabbed it. There was concerns about, obviously, an inmate somehow getting the glove from the staff member. I know that the union was supportive. I did have a conversation with the union about it. We have since looked at other security equipment that we have put into place that we do feel is equally safe for our staff with regard to transporting it.
Equipment, because I think peeling a glove off of an officer, my understanding those gloves are positive for cell extractions, riot control, helping to subdue violent inmates. We were talking about inmate on inmate violence and inmate on officer violence. What is the new alternate measures that have been implemented instead of those gloves, which is great if we're doing something new and alternate. What is that new and alternate item?
I'm talking about yeah.
So everybody's issued, officers are issued chemical munitions, the OC spray, so they have that at their disposal. When you're talking about electronic immobilization devices, we have them for transports also. We have a vest and also a rack belt that can be used on transport.
So those are new things that were implemented after that review?
No, we also introduced a new cuff bag, and those restraint systems is what I was referring to.
Oh, okay, I'm sorry. Yes, we have some folks that do some frequent self-injuring, so we have some other restraining devices that can be used to prevent people from engaging in non-suicidal self-injury.
Yes, it's my understanding that those gloves have been positive at some of our county prisons. I think the governor's team may use those, and as we're doing that review, I think a direct glove, in an extraction, or if an inmate's attacking an officer or an inmate, it might be a positive thing. I would just encourage continued consideration of that. Shifting over to the closure side, Westmoreland County, we experienced an abrupt closure in, I think it was 2013. January it was announced, June it was closed, and it really touched off a multi-decade blight situation where we still are struggling with this, massive prison that is going to be costing. Now it's in the hands of the township. We're using state dollars, township dollars. In the event that we would be closing one of these facilities, is there going to be more responsible engagement to have almost a cradle-to-grave closure? Because it's still a problem in Westmoreland County. It's not a problem on your desk, it's a problem on our local officials' desk.
I think the biggest thing, it's unfortunate because there's not a lot of market for these facilities to begin with. If we close a prison, there's not too many ideas. Pittsburgh, they thought that they would be valuable property. It's still there. I mean, I think the biggest thing is minimizing the mothball costs as much as we can, but we do work with the Department of General Service. They will do a facility assessment to see what other marketable opportunities
it's created a multi-decade blight issue, within Westmoreland County, and I would encourage that consideration, to be included if we're looking at, instead of closing those units, if we have a capacity issue, why not, or closing a full prison, why not just close some units within that prison so that the ratios can be higher, we can still have inmate safety, but we also have that flexibility to enhance mental health services, which may be a need, or some of these safety trainings. Why not just more efficiently use the space inside the prison?
We actually did that this past year. We closed the equivalent of 18 and a half housing units. It saved us about $7 million. You're not going to see the cost savings that you would see with a closure, but we absolutely did that to maximize our space and help with overtime. But also, one quick point, it is part of the Act 133 process, how that land can be utilized. People can certainly submit their feedback again during this 3-month period.
That's great. Thank you, Mr. Chair. Thank you.
Thank the gentleman. Representative Bellman.
Thank you, Chair, and thank you all for being here. Madam Secretary, we know that individuals with autism experience difficulties at all levels of our criminal justice system, and we know that SCI Albion has a first-of-its-kind unit to deal with individuals and to give resources to individuals with autism. Can you just tell us a little bit about SCI Albion and the unit that you guys have?
Yes, super proud of the work that team has done there, and very proud of just the collective work. Actually, Dr. Melischak was the psychology director at the time when that unit was stood up. Right now, we have about 49 individuals diagnosed with autism on that unit, and about 19 with ID, intellectual disability. And then we have another approximately 29 individuals that are housed in other settings. There are some that are housed on our residential treatment units. There's only about less than 1% of our population right now that is diagnosed with autism spectrum disorder. Yep. But we also did a rollout of a lot of training for our psychology staff and our security staff as well. And I know the team at Albion has partnered with some folks on the outside to get more training, and it's just been really just a wonderful addition to our overall mental health services and just looking at this population. I know I saw on the news about PSP I think they were doing some role plays, and one of them was, I think, autism. I think I saw that on the news, just different types of mental health conditions that folks might be struggling with and how to interact with these individuals. Because we know that sometimes those interactions need to look differently than they would with someone else who doesn't have that.
And can you tell us a little bit about how, if a person enters into the system and they're not diagnosed with autism, is there a way that they can get diagnosed once they're in the system?
Yes, absolutely. We have a psychiatric team, but I'll let Dr. Milischek take that one.
Sure. One of the biggest advancements that we've made in the last 3 to 5 years with identifying people with autism is establishing partnerships with community advocacy groups and the community jails. And so we have really bolstered up the sharing of information. But every single person that does come to our system receives an interview with a psych staff member on day 1. And every person that's coming through our system now is getting screened with the Autism Quotient 10 tool, the AQ10. And based on the results of that screening, if they screen high, they can be diverted for a more in-depth psychological interview with a psychologist, where they could actually go through, complete all of the individualized testing, the functional testing to determine whether or not that person actually meets the diagnosis. That wasn't happening until a few years ago, but we're also pursuing looking at the current population of people who are living in our system. So we've taken care of the front door to address the people who are coming into the system, but the problem still remains that we have almost 40,000 people who are living in our system, incarcerated currently, who might also be undiagnosed. And so we have begun targeting our screening efforts at those populations who are most likely to be to have autism.
And how are you identifying those individuals that you think are most likely to have autism?
So we're going with what the neuropsychological research says. People who are more likely to have comorbid diagnoses of mental illnesses, people who are likely to have diagnoses of intellectual disabilities are also known to have higher rates of autism. So we have approximately 230 people in our system who are diagnosed with an intellectual disability. And so we began our efforts inside looking at that specific population as well, because again, we know that they're at higher risk or higher likelihood of also having an autism spectrum disorder.
All right. And so right now, do you guys think that the resources are matching the needs?
I believe so.
I think so, yeah. As the Secretary said, we're only at about 50. But if you could imagine, just 2-3 years ago, the number was in single digits. And so we still maintain a ratio of about 1 mental health provider for every 50 people who are receiving mental health services. So that's a pretty healthy staff to patient ratio.
And I will say, if we would see an increased need and the more autistic folks getting diagnosed, we have the capabilities to duplicate that program at another institution. So we're pretty good about saying, like, okay, we see an increased need here, let's open a second unit. And the good thing is it's so successful at Albion, we'd be able to stand it up similarly elsewhere if needed.
I would also add that this is part of the 1115 waiver, that this population with autism spectrum disorder is going to get intensive case management services prior to release. That way they're getting set up for any type of services they might need as they move back into the community.
Awesome. Thank you. That's my time. Thank you, Chair.
Thank you, gentlemen. Representative Alsamer.
Thank you, Mr. Chairman. Madam Secretary and team, thank you very much. Madam Secretary, the governor's proposal to legalize recreational marijuana involves the immediate expungement of records of those incarcerated for only a possession-related offense attributable to cannabis. Were you consulted by the governor about this proposal?
We were not, but I will say our numbers are 10, roughly 10 individuals. This isn't a group of individuals that we see a large population in our system.
Yeah, thank you. So your estimate is about 10 people that that could be released, basically, or affected by this law. Is that correct?
Yeah, based on the data that we've been able to run, yes.
Yeah, so there wouldn't be much of a savings there. Do you think most of these people would be released from county prisons versus state prisons?
Yeah, my guess is that the majority of them are, because they're lower level offenders, most of them are probably being placed in county facilities.
Okay. How does expungement of marijuana-related criminal records and the resulting impact on inmate population factor into the proposed closures of SCI Rockville and Quhanna Boot Camp?
It would be negligible because, as I said, 10 individuals, so that would not be a factor.
Okay, thank you. While this goes without saying, I just want to confirm the governor's proposal to legalize adult use cannabis in the Commonwealth does not include legalizing it within the Department of Corrections system. Is that correct?
Can I get, what do you, I'm not sure what.
Obviously, you're not going to legalize it within your system.
Oh, for like inmates to use while they're,
Yeah.
oh, no, absolutely,
Yeah.
correct.
Are you concerned cannabis in the legalizing cannabis in the Commonwealth would make it more difficult to keep cannabis out of SEIs?
No, I wouldn't have that concern because right now, of course, we have procedures in place for anyone who would come to work maybe with substances on them or with the high from whether it's alcohol or other substances. We have procedures in place for staff, obviously, that we do fitness for duty. They still have to come to work fit for duty. And if they don't, we have procedures in place to get them tested and so forth.
Okay, and that leads me to my last question. What personal management impacts does the Department of Corrections expect to see as a result of that proposed policy?
Well, obviously, folks who have firearm responsibilities as part of their jobs would not be able to use marijuana. That would still stand, whether special teams, corrections officers, those types of individuals. And as I said, for folks who are non-firearms carrying staff, they would still have to come to work fit for duty. So if individuals did not, we do a fitness for duty assessment on them. We take them out for testing, and we, of course, have resources available for individuals who may need those.
Does the department do random drug testing, or how is that done?
On staff, no, but we do electronic drug detection. So when people come in for work, they can run through the ion scan. We do it for visitors, contract staff and inmates as well. And we do random testing of our inmates, of course.
Okay. All right. That's all I have. Thank you very much.
Thank the gentleman. Representative Brennan.
Thank you, Mr. Chairman. Thank you all for being here today. I read that corrections is our third largest department. I haven't heard it said. I think it's $40,000 a year roughly to incarcerate someone. I think it's a reminder for everyone in this chamber how important it is to invest in our kids and our communities now, and I think we should all remember that. I have a couple questions on Rockview and the closure, particularly related to the estimated $74 million in improvements that are needed. Has there been a process recently to determine those $74 million? Is there a running estimate? Is there any breakdown by specific building? Perhaps you could just tell me a little bit about specifically the process to come up with this and what's being considered.
The process for this, for the $74 million that you're asking about, is specifically capital projects. So these capital projects, these are large construction or repair projects. Anything that is over $600,000 becomes a capital project. And then we have to work with DGS's division of capital projects, formerly Public Works. And then this goes through a bidding system for design by a professional and then construction. So we do have a list of those 74 that's roughly within a 10-year period. There is a plan for every facility to show what capital project, what things need to be repaired. It could be roofs, it could be boiler plants, a variety of things that are listed on any facility.
So there is a 10-year plan showing this?
Yes.
All right. And is there any breakdown by building? I understand blocks A and D are in one particular building.
Yes.
That's probably one of the areas that need the most work, I assumed?
The older block house with the 5 tiers, correct.
Yeah.
There's a roofing project that's scheduled.
How much is that? Do you know offhand?
I don't know right off the top of my head. I can tell you.
And that's fine. You could provide it to us later. But has there been any effort or is there any quantification by building in that 10-year plan?
Yes, sir. Absolutely. Very detailed plan.
All right. And can that be provided to us as a follow-up to these questions?
I will say the final report that we will compile after we get feedback will certainly look at specific projects that have been completed, have yet to be completed. We will identify that in the final report that will be made public. Yes.
And could the legislature get a copy of that $74 million, the 10-year plan as well? Can you provide that to us after this hearing?
We'll review exactly what information we're looking at, and if we're able to give it to you, yes.
And would that include any list of the investments over the last 5 years?
Yes, we provided, yeah, we have that as well.
Okay, thank you. And has there been any consideration of a merger of I guess, the two adjacent buildings there? Has that been considered in any way? Has that been studied in any way?
Which two facilities?
I guess the closest is Benner. They're almost overlapping.
I'm unsure what you mean by merger, because essentially if we would...
Well, like if there's buildings that are operationally costly, has there been any consideration of that, a possible merger? I'm just trying to know if that's ever been considered.
SCI Benner is a relatively new facility.
Yeah.
I mean, SCI Rockview was built in the early 1900s.
Second.
They're on the same property.
Yeah.
There are some buildings that are shared.
Mm-hmm. They do have some consolidated services. But inmate housing is not something that's consolidated.
It hasn't been considered?
No, because I don't know where you're going to find the savings if we're going to continue to operate a facility in some type of merger versus shutting down a facility is truly only way you're going to save costs.
And that's driven by the $74 million or is it overall savings?
The $74 million would be a factor in decision making. If we only get roughly about $50 to $55 million a year in capital funding. That's a separate line item, not operating. And that $55 million has to cover every institution we have for all projects. Something as large, this is the largest number of projects for any one facility, this $74 million. I can tell you that. So obviously that is part of our decision making is when we're seeing we have to maintain these facilities. And we have to only have so much to invest, almost so much money to go around. How do we keep them operational and safe for our staff and inmates?
And again, I'm looking forward to seeing the breakdown. And you're bringing up safety. There was a 21.6% increase in violence against corrections officers last year. That's a real concern. When we're, I guess, shutting down a facility, we're going to be moving populations possibly from the mid-state to, one end of the state. Could that create any issues with, I guess, how inmates are interacting with corrections officers?
Our Bureau of Population Management has been involved with every closure that we've ever done. They do strategically look at where to place our incarcerated individuals. Yeah, we have gang activity in our department. So of course, if you're referring to like gangs and those types of things, but if an inmate has a separation from another inmate, like if you have a separation from me, you're not coming to my jail.
And that's fine. Mr. Chairman, if I could just ask one quick follow-up question.
30 seconds.
And the other thing is we'd be merging, I guess, would we be taking a large population and putting them into other facilities? What, can that cause risks to some of our corrections officers?
Yeah, as I indicated before, we will still not be at capacity. We will be under 90% capacity at our male facilities and under 80% capacity at our female facilities if they close. So, yeah.
Thank you for your time. Thank you, Mr. Chairman.
Thank the gentleman. Representative Marcel.
Thank you, Mr. Chairman. Thank you very much for joining us this morning. I actually first had a follow-up question to one of my colleagues. You spoke earlier that there was an increase of violence that occurred in 7 jails. I think you were speaking more about the temperatures and that line of questioning, but could you share with me the inmate capacity at those facilities? There were 7, I believe.
Yeah, we can get that information to you. You want, like I said, the increases were, I don't want to say restricted to, or were primarily at those 7. So you're saying you would just want the general how many inmates are at those facilities.
Yeah, the inmate capacity at those facilities would be really helpful to know. Thank you very much. I wanted to move on to talk a little bit about your vacancy rates. I know that you've been unfortunately dealing with high vacancy rates among correctional officers. We know high vacancy rates are a driver of overtime, unfortunately, which obviously makes your costs go up. So at last year's hearing, you were able to report that mandatory overtime had dropped as a percentage of your total overtime. So given that all these factors are obviously interrelated, could you share a little bit about your vacancy overtime and mandatory overtime rates right now?
Yes, we did see an increase in a 2% increase from 13% last year to 15% this year. I don't know if I have the voluntary overtime.
Voluntary overtime has gone down over the last 4 years overall. So the total overtime is coming down. As the Secretary mentioned, mandatory overtime went up by 2 percentage points to 15%. Normally our goal is 10% is what we're looking for mandatory overtime.
Okay, thank you. And does that vary significantly among the different facilities that you have?
Yes.
Is that information in your testimony, or is that information you could share right now with us?
I don't have that information right now, but yes, some facilities have lower vacancy rates than other facilities. Overall, yes, we're at 4.8%, but we have some facilities that pretty much don't have any issues with their vacancies. So, yeah, depending on what facility and their vacancy rate, we can look at. You want the number of mandate or just?
I mean, I would say overtime and mandatory overtime, just some statistics just broken out by facility so that we can just see if for some reason there's something that's different. Okay. And then I would say, do you have any commentary on how the closures that you're speaking about would potentially change those overtime and vacancy rates?
Yeah, of course, it would move it in the right direction.
Right. What we normally do is we take a look at, if we're going to consider closing a facility, we will monitor the complement at those facilities to make sure that they have adequate staff, but also to start creating landing spots for staff who would want to move to that facility. So we'll manage that going forward, because we want to be able to give our current employees opportunities to select where they like to go and make sure we have enough positions for them in every facility. And if we have to go over complement to some extent, we can. Understanding, this has been brought up a few times, just want to reiterate for the entire committee, this is a very large complement, 8,500 positions in the Commonwealth for correction officers. So when we have vacancies of 900, that's a train that's going to take a long time to get back up to an optimal level. We like to keep under 2%. We've seen this before, and with COVID really put our numbers down. And little by little, as we get away, we can do more mission-based hiring, and we're going to start seeing better retention rates and have less turnover with new staff. We attrit 50 officers a month in this complement. So we're just trying to keep up not only with the attrition, but also these vacancies.
Thank you. And obviously, in a 24/7 operation, like in correctional facilities, it's unrealistic to expect that you're going to eliminate overtime, because it's just something you're going to have to do. Do you have a target or a goal for like a certain range that you would like to be in, given maybe in the future when some of your numbers are leveling out? Do you have a sense of where you'd like to be?
Right, like you said, it's a necessary evil in a 24/7 operation. Our administration division actually did an assessment of where we would be strictly based on our contractual raises, and we are targeted to be pretty much where
we are.
We are now, yeah.
When you look at 17-19, there was about $109 million in overtime. Just taking the contractual wages for the H1 bargaining unit and adding those raises year by year, 5, 6, 7% in any given year, that would come out to almost $159 million. And right now, we're looking to be at about 145.
Okay, well, thank you very much. I appreciate it. I just wanted to mention that if there is an opportunity, if there are members that are doing any tours before these closures are looked at, I'd be happy to join you on that. But thank you, Mr. Chairman, for your time, and thank you for being here today.
Thank the gentlelady, Representative Guzman. Thank you, Mr. Chair, and thank you, Team DOC, for your time this morning. I'd like to talk about the CCCs, which is the other two facilities that are going to be closing. And in the governor's budget, proposed budget, he is proposing closing 2 CCCs, including the one in Warnersville. Is that correct?
Correct.
And according to your testimony today, those closures are already underway. Is that correct?
Correct.
So I'd like to talk a little bit about the cost of both of those facilities. Now, it's estimated that both Warnersville and Progress, it's going to save the Commonwealth about $10 million, let's put it. However, my fear is that if parole violations and recidivism increase, is it your opinion that this will result in higher long-term costs for incarceration, emergency services, and/or law enforcement in Reading and other surrounding areas?
Deputy Carpenter, I don't know if you want to talk about our parole violator rates, but how we're bringing people back into our system is not going to change. Go ahead. Do you want to talk about? Or EDS?
You want to go? You want me to talk about the violators?
Yeah.
Yes. Okay, so currently we're actually seeing a decrease in our parole violator numbers. Our parole violators numbers are down from last year. Our technical parole violators are down by 10%, and our criminal parole violators are down by 3%. I don't think the closing of these facilities are going to impact those violation rates. We don't typically use the CCC as a sanctioning tool. We work with these individuals in other ways to avoid possibly back to the CCC or even back to the incarceration.
Thank you. So, Madam Secretary, the steering committee's report that you included with your testimony today, it says, quote, that the closing of CCCs will reduce reentry infrastructure, increase pressure on private halfway houses, and may impact parolees' success rate. Do you agree with that assessment?
Where are you saying that is?
In the steering committee's report that was included with your testimony today, it says, in that report, it says the committee reports that closing CCCs will reduce reentry infrastructure, increase pressure on private halfway houses, and may impact parolees' success rate. Do you agree with that assessment?
I honestly don't recall reading that in the report. I'll certainly look at the context of where that was written, but we wouldn't be closing it if we felt that we couldn't. These 2 facilities have the highest reentrant cost. And we have other facilities that we are safely able to place them in, because we have seen a decrease in our community corrections centers. Long story short, years ago, we kind of moved everyone from incarceration and a prison into a community corrections center and then home. But our research showed that individuals who had a home plan could be more successful if they go to their support system, which makes sense. But oftentimes, our individuals don't have that support system. So we need community corrections. It's not going away, but we have seen a decrease in the overall footprint of our community correction centers because of changing who goes to centers and who is able to go home.
And while you have seen a decrease, we have seen an increase of halfway houses within the city of Reading. And so I'd like to ask you about your oversight of these private facilities. How does DOC will ensure that these private facilities maintain quality services instead of simply becoming warehouses for individuals?
We have always had contract community correction centers. Deputy or Melissa Tracker, EDS, do you want to comment on our oversight?
We have staff dedicated to the oversight of our contracted facilities. We call them CFCs, they're contract facility coordinators, and that is their job. They're essentially the director of our contracted facilities. They're in there multiple times a week, ensuring that they're complying with the contract and doing the steps necessary for successful reentry.
And how many facilities do those directors on hand oversee?
It depends. It depends on the population of each facility. Some CFCs have 1 facility and others have multiple, but it is quite manageable.
So, I mean, the community of which I represent would say otherwise, of course, because, again, we're being overrun by halfway houses across the city of Reading. And I know that it's not just happening in Reading, but all across the Commonwealth. Now, in regards to these closures, you know, unlike in Act 133, you all were required to have community input on this. And of course, this doesn't happen with the CCC. So is it your opinion that CCC closures should be subject to the same Act 133 requirements as the process is in regards to state prison closures?
This was the legislation that was passed, that it only included our correctional facilities.
Would you be in support of the legislature adding that to
What I was going to say is we always welcome feedback, whether the centers, we have historically closed centers in the past, and whether they fall under the act or not, we always welcome feedback. So if anyone has any feedback, by all means, send it to us.
Well, no feedback was given from the city of Reading on this. Thank you very much, Mr. Chair.
Well, they're welcome.
Thank the gentleman. Chairman Briggs.
Thank you, Chairman. And I don't have any questions for Chairman Fox, but I want to thank him for his being here with us. You and your staff are always very helpful to me and my staff. I kind of want to focus on a couple questions regarding the reentry conversation. Representative Ecker is working with Representative Krajewski on a medical release bill, which I'm really excited about. Trying to build a bipartisan coalition with your support to talk about that. But he brought up the 1115 waivers. My understanding is from last year's hearing that the request was put in for the waivers, they were awarded, but for us to enact a number of them regarding corrections, we have to change the law. Is that accurate, or maybe the deputy could address it? We were talking like the waivers were enacted and were ready to go, but I believe we have a little bit more work to do to allow us to fully utilize them.
That's correct. Our understanding as well is that there's legislation required in order for us to enact all of the processes that we'd like to see happen.
Great. So we advanced that legislation through committee. It was unanimous through committee. I was really actually pleased. But then on the floor, it turned party line. So I think we have to revisit it this year, hopefully educate both sides of the importance of passing this legislation, because I do think it allows better outcomes, allows us to save some money. Could you talk a little bit about the benefits of fully enabling that waiver program?
Sure. I was attempting to describe this earlier. The four biggest benefits of this program are the following. The first is to enhance the continuity of care process, so us handing off people who are living in our system to the healthcare system in the community. The 11 and 15 waiver will hopefully streamline that process. Next, we hope to reduce the risk of overdose as people who are leaving our system and have been living with drug and alcohol use disorders their entire life, going back out into the community and having much regular access to those substances are at increased risk. Having this waiver in place will ensure a streamlined handoff to drug and alcohol treatment in the community as well. Next, our hope is that believe it or not, the populations that this waiver is focusing on are the most marginalized populations that exist. So they are people who are living with substance use disorders, diagnoses, including opiate use disorders, seriously mentally ill, those people who are living with autism spectrum disorder. And our hope is that this waiver, again, by increasing the access to healthcare upon reentry, we are going to be able to reduce the recidivism amongst this population as well. And finally, kind of in between the lines, you can hear the overarching goal is to increase public safety. And so those are the biggest benefits that we're hoping for with this 1115 waiver.
Great, thank you. So I've reintroduced House Bill 282 this session. We are working with you all and DHS to try to continue to educate the whole body. And as soon as we're ready to go, we will advance it. So thank you for that. Also, a previous discussion on the, prison industry enticement, PIE. That is introduced in the Senate. I have been looking at that bill. I'm glad that there's a little bit more interest. I know Chairman Harris was very involved with Salus University and the partnership regarding eye care and training, and I had a school in my community that was a partner with that through eye exams with Salus and then getting free glasses through that program. Would PIE allow private partnerships, not quite like the Salus, but to expand? If you could talk a little bit more about the PIE program and how other states have benefited from training and job training and all. I think some of the biggest advantage, first of all, is we can pay prevailing wages to our inmates. And then this money could be used as either family support or help with victims' restitution. But right now, we could only do business with other state agencies or nonprofits. PI legislation allows us to directly do partnerships with businesses in the community. So that's the big advantage without affecting the civic jobs currently in the community. There is a committee that has to be set up to ensure that we're not taking away from people already working out in the community and take their jobs away when we do PI. But we have the advantage of working with other businesses, for-profit businesses, and partner with them to a variety of productions.
Great. Thank you very much for your questions and for your patience. Thank you, Chairman.
Thank the gentleman. Chairman Struzzi.
Is it? Okay. The light didn't come on. There it goes. All right. Thank you, Chairman Harris. So, as we were discussing earlier, SCI Pine Grove is maybe 2 miles from my house. A lot of the people who work there are involved in the community, you know, and I think, you know, we truly appreciate, you know, the impact of having a state correctional facility, you know, in our county, Indiana County, and, you know, the economic impact that it has, and the importance of those jobs for the local community, and the fact that, you know, these men and women who work there, staff, corrections officers, are truly involved in making our community better. So when Representative Nelson mentioned the impacts on communities, I think that's something that really has to be considered when you're looking at potential closures. But my question is, given how many employees will be impacted by this, staff and corrections officers across the board, before the governor made that announcement during the budget address of closures, which he didn't identify which facilities were going to close, was the Corrections Officers Association informed?
I first want to say this about the impact. You're right. We understand the impact. I've actually been through a closure. I have 2 team members on the executive staff who have been on that end. So we certainly understand the impacts, not only to our staff, to the incarcerated folks in the communities. And Act 143 allows for that feedback. With regard to, you said specifically PSCOA?
Yes.
No, none of the unions were notified prior to February 4th.
Is that standard? I mean, shouldn't they be involved in those discussions prior to? Because when the governor made that announcement, no one knew where the facilities were. So it's my understanding, you know, even in my community, people were like, well, where are they going to close? Which ones are going to close? Is it going to be us, our homes, our families, our communities impacted? Because I don't believe the actual announcement of what facilities were going to be proposed for closing came out until a week later.
It was a week later, correct.
So would you do that differently if you were to do it again?
Actually, I would not, and I'll tell you why. Back in 2017, I believe it was, 2017 was with Pittsburgh, the department made the decision to announce 5 facilities that were kind of on the table. And that was a lesson learned for the department, because it did create significant stress and anxiety, because again, I understand that stress, I've been through it. So when you think your facility is on the chopping block, it creates a level of panic and stress and anxiety. And so we were trying and would continue in the future to minimize that level of stress and anxiety for our employees. Right.
But didn't that create a different level of stress and anxiety because no one knew what was going to close? You know what I'm saying? Like, no one knew where these facilities were. So for a week, you know, staff around the Commonwealth were questioning, where
You're right.
Is it my facility?
You're right. And before it was months. Yeah, and we have to follow Act 133. Act 133, you know, it says when it is proposed, and that's what we did. We proposed it.
I appreciate that, and I know you have to follow the act, but I think it would make more sense to at least give some notification so people, the facilities in question, yes, they're going to, you know, they need to know, but I think more clarity in front would have helped ease some of that anxiety across the Commonwealth. But moving on, who ultimately makes the decision when you're done with the process, done with input, who ultimately makes that decision on whether or not these facilities will close?
I can tell you how it was done with the retreat process. Obviously, the recommendation will be made from the steering committee to me, and then I will share that information with the governor's office.
And the steering committee is comprised of all Department of Corrections staff, or are the unions represented at all on the steering committee?
No, because Act 133 allows for feedback during this 90-day period. So when we send all the unions letters, stakeholder letters, we want their feedback. Of course, we'll have public hearings, and they will have an opportunity to share any feedback at those hearings as well.
Okay. Well, I appreciate you being here today. I would just say, I think it's important that, all of the factors, all of the impacts are considered. The loss of jobs in those, in some cases, rural communities is going to be a large impact. And then you still have to apparently maintain these facilities for a number of years, and that's still going to be an additional cost. So, we can question DGS on that, but I think it's great that you're trying to save money, but I want to make sure that it's a wise choice with all of the impacts considered. So, thank you.
Thanks, gentlemen, Secretary and Chairman Fox. So, Chairman Fox, I'm going to ask you a question.
Thank you.
I don't want you to feel lonely and left out. You did come today, so I want to ask you a question. As we talk about the closures that are proposed to happen, there are, I guess, members, inmates who would be up for parole. Would the closures at all hamper their parole hearings?
No, sir. We'd be able to accommodate that. We have inmates that are moved around the department now for various reasons. We are always able to track parole dates. We are always able to get those individuals seen. I don't anticipate any impact on the ability to make parole because of any closing of an institution.
Thank you. And follow up to that. Inmate A is at one of the facilities closing, goes to a new facility, has a problem adapting to the environment of that new facility, and they are up for parole. Would the parole board take into consideration the fact that this inmate is in a new facility when reviewing their application for parole?
Yeah, part of the parole process is an actual interview directly with the inmate. So even though the records may indicate that there was some behavioral problem or something along that line, we would certainly give the inmate a chance to talk about why this issue came up and kind of collect feedback before we would make a decision. So that would be certainly under consideration, the fact that somebody was moved and uprooted, especially if they've been at an institution and doing well for a long time.
Thank you for that, sir. Secretary Harry, I have a couple questions for you. Chairman Briggs brought this up. Can you tell me how the program at Cambridge Springs is going with the eyeglasses and the female inmates?
Yes, so there's 27 inmates who are employed. They made a total of over 800 glasses since they had this partnership. Last year alone, I think it was like 526. It's going very well. They also, which I'm very excited about, and they are too, they opened up an optometrist office, essentially. So these individuals who work there have the experience of working with the eye doctor and doing some of those tests that we all get, for those of us who have bad eyes, all those tests that we get before we see the optometrist. So that's a huge benefit to them, because we have had some of our females write back in and say, hey, I got a job for like $40-some thousand. It's a very great opportunity for them to secure employment. And one lady, I remember last year, the year before, had written in and said she was one of the only 2 people in her office who knew how to use one specific piece of equipment. So they are getting great experience around it. Also, obviously, having a sense of purpose to provide glasses to those individuals who need it. So it's going very well, and they do a great, great job at Cambridge Springs.
Well, I want to say thank you, and thank you to the folks at Cambridge Springs for keeping the program going. We were glad to be a part of that. Wanted to talk about something that you said. I wanted to see if you could go deeper into that. You talked about when you reviewed the closings previously that we've done, you talked about inmate on inmate violence and inmate on inmate staff violence going down based off of the data that you've seen. So can you explain that a little bit further and go over those numbers again for me?
Yes. So we actually pulled the data from our 5 prior closures, and we looked at the 6 months prior to the closure and 6 months after the closure. We actually, based on that data, saw a decrease of 1 less inmate on inmate assault and 3 less inmate on staff assaults. Now, full disclosure, inmate behavior, human behavior can be unpredictable, right? So can we say with 100% certainty that that will occur with this closure? No, we can't, but I can tell you with the prior closures, we did not see an increase in violence. And as I mentioned, we will still be below capacity.
So let me ask, so if we're taking your data points, would you say that the last 5 closures have made your staff safer?
Based on the data, it would appear so. Yes.
Thank you. Want to switch gears and ask a question. That red light has nothing to do with me. My executive director is trying to be funny today, okay? We're going to have a conversation after this. Let's switch gears to the mail program. I've had a lot of folks talk about are we still shipping mail out of state to get scanned to then come back in the state?
Yes, general mail, yes.
Okay. How much does that cost us?
About $4.5 million.
Okay. And where are we shipping it to?
Florida.
Okay. Why are we still shipping it to Florida and spending $4 million to ship it to Florida and not doing something here?
We actually
Look at it, yes.
We're currently exploring this with DGS because they have a print shop that they're printing all of our hard copy once it's digitized and sent here. And we're hoping that DGS could take over the scanning portion as we potentially move into a tablet format for the inmates.
Okay, so
that's kind of in motion.
So it's in motion that we not continue to spend all that money?
We're hoping that they can do it.
We're exploring the option.
Okay, all right. Thank you. I'm glad to hear that. It just, no shade to Florida.
Fair enough.
I just don't want to send money to Florida when we need it here. Phone calls. How many free phone calls are inmates allotted a month?
Yeah, we don't do the free phone calls.
Okay.
We did briefly during COVID, if I recall.
All right.
Free emails.
And free emails, yeah.
So how much are we charging inmates to make phone calls to their parents? I mean, to their family or whoever?
Right, the rate was reduced from 6 cents to 4 cents.
Okay. Now, with the internet and internet calls and whatnot, why is there still a charge for inmates to make phone calls to their family members?
To make phone calls right now?
Yes.
You only have so many banks of phones out in the day room, and, having inmates, that's a security issue too, because inmates try to take over the phones, influence who gets to use the phones. So there are some security implications there to just make it completely free. If we were going to do complete free phone calls, the cost probably, you'd have to add another $15 to $20 million to our budget if it's free.
Why?
If we're providing free phone calls and you don't have to, you're not getting charged for any calls you're making,
we would have
there's
to
a service fee that we would have to incur the cost and add additional money to our budget, is what I'm saying.
Okay, so you're saying that there's a service cost for those phone calls?
Service cost for everything. So that's what I'm saying, that if we made the phone calls free for inmates, at least at minimum $50 million in additional funding we would need for the DOC to pay for those free phone calls.
Okay, I would like to explore why, being as though most folks are making phone calls over the internet for free. And if we already have internet service in the building, then I'm trying to understand where the additional 15, 20, maybe I'm missing something. I'm not saying I'm an expert on it, but it just seems something is going on there, and I would just like to, understand that better.
Understood.
So we don't have to do that right now.
They also have to be recorded, so we have security features in place for calls. And I also want to say that some states actually charge more than we charge in Pennsylvania. So, and we could research some of that data we have in the past. So.
Yeah, that charge, our fee was lower than the FCC regulation came back.
Correct.
We were already underneath at 6 cents a minute, and then once that happened, commissions were going away from, that we would put in IGWF for inmate activities and other services. We lost that commission, but we were not going to let the current phone service company to keep that as profit. So that's how we went from right under 6 cents down to roughly 4 cents, the Secretary mentioned.
Okay. Do you provide the opportunity for inmates who are parents to take part in parent-teacher conferences with their children?
I'm very glad you asked that because we're starting a pilot this year. I don't know if either one of you wanted to talk about it, but we're excited about working with the Philadelphia School District at least to explore this pilot.
Yes, our Division of Treatment Services is currently working with the Philadelphia School District, and certain inmates will have the availability to participate starting spring with their parent-teacher conference. It could roll out to every institution, and we will have conferences for every grade level within the school district.
And I really appreciate your feedback because I think you brought that up maybe last year, and we were trying to get it off the ground at one facility, but our staff worked really diligently to figure out a way to at least see if we could get this because, again, it's important for them to, as a father, to be involved in their schooling and show that they are invested in their education.
So, first of all, I'm glad to hear that that is going to happen. You know, I think there's a program, I think it was run out of Phoenix, called the FACTS program. And we've seen tremendous success with the men being able to be involved in their children's lives. And that so that when they get out, there's no period of reconnection necessary because they had been a fixture in their child's life. And we've seen that that has helped some of our men stay home and not reoffend because they have that family support. So I'm glad to hear that we're going to move forward and extend that with allowing them to be a part of parent-teacher conferences, which I think is also a tremendous benefit to the child, to the teaching staff and whatnot, to have those folks involved in their children's schooling. I think that, we did want to get one, if you could provide this in writing for us with regards to vacancies, staff vacancies at each of the SEIs, and also vacancies with regards to inmates at all of the SEIs.
Bed space.
Bed space.
Yes.
So if you could provide us with that in writing, that would be great.
Yes, no problem.
And I think that is all of my questions.
Thank you.
So with that, we want to thank Secretary Harry. We want to thank Chairman Fox and all of the staff from the DOC and Department of Probation and Parole for being here with us. Shout out to Diane Woodside, my buddy back there, who always helps us get things done working inside the DOC. So we are going to conclude this budget hearing, and we'll be back this afternoon, let's say 1:15, with the Pennsylvania Utilities Commission. With that, this budget hearing is adjourned.